Hi, this is Michael Jordan, President of our Labor and Strategic Accounts Division at MagnaCare, joining you today from our Tinton Falls office. Today's topic is on the ACA and the 2016 upcoming presidential election. And regardless of what you hear, whether you're a Democrat voting or you're going to vote Republican, the ACA is here to stay. What it may look like in the future will vary depending on which party gets in. But bottom line, we're going to see much of what we've seen today. And if you think about it and you go back in history, when the Democrats passed the Medicare and Medicaid and the Republicans weren't too excited about it, we are here 50 years later, and Medicare and Medicaid are still here. When Medicare Part D was passed by the Republicans, the Democrats weren't too excited about that, but Medicare Part D is here to stay. So as we go into 2017 and we have a new president, regardless of what party wins, the ACA is not going away. And many have termed the Affordable Care Act as the Unaffordable Care Act. So hopefully as we go into 17, more changes are made to make it a more cost-effective, high-quality solution. So what happens if Hillary wins and the Democrats get in? They're going to repeal the Cadillac tax. And within the body of this discussion point, you're going to see many things that the Democrats and Republicans are thinking about. But the key things are, one, repealing the Cadillac tax, which if you're a plan sponsor is obviously very important because that if you're offering a rich benefit level, that could have a significant impact on you. And obviously if you're a consultant or broker and you're out there advising your client, this plays a big part. She also wants to expand the criteria for those families or types of families that are going to be eligible for subsidies or tax credits. So really the Democrats want to expand on what that looks like. The third important point that they're talking about is creating a public option. This was part of the original ACA architecture, but was put aside. And in essence, expanding on the public option through the state level, there may be a plan created through the state that uses Medicaid-type reimbursement levels and competes against the commercial insurance companies that are currently offering ACA-type programs today. Now, if Donald Trump wins and the Republicans get in, the agenda would allow more for taking insurance, which is today operated on a state level, and expanding that and allowing insurance to be offered through a multitude of states. So a good example there would be companies transacting business in New York today could transact business in Connecticut, New Jersey, Delaware, or really any contiguous or non-contiguous states. This would create more competition from a private insurance company perspective. In the end, it really doesn't matter which way the election goes, and obviously there's a lot more important issues than just the Health Care Act. But we're here to stay. I think the ACA will continue. What it's going to look like in a couple of years will look significantly different than it does today. Thanks.